Hello everyone, my name is Dr. Joel Rosen, and I wanted to make a little presentation today because I had an interesting conversation with a prospective patient. I called the patient because whenever I have a lead that requests for more information for my thyroid recovery program, I like to give them a call and ask them any questions as to what I may be able to do to help them or give them a point in the right direction. And as soon as she found out that I was a chiropractor, she was like, "Oh no, I don't want to have anything to do with that." And I understand that because typically chiropractors aren't known for doing are known for doing neuromuscular treatment. People who have neck pain, back pain, migraine headaches, sciatica, potentially carpal tunnel. But when it comes to a chronic condition like thyroid, then we typically think of the allopathic or the traditional medical model. And that's totally understandable. So the way I first started to get into metabolic cases was I had a patient that brought this book to me. It says, "Why isn't my brain working?" It's a great book. The author of this book is Datis Karazian, and I would suggest that you look or go get this book because when you are suffering with a chronic condition, then many times what happens is you are not converting food into energy very well. And then when you're not converting food into energy because 30% of your brain requires all the fuel that you convert, then your brain's not going to work properly. So when I see patients that have thyroid problems, that's not the only thing they have. They have depression, insomnia, brain fog, mood disorders, the changing of behaviors, lack of energy, and all these things are regulated by your brain. So getting back to the chiropractic thing, so I decided that traditional chiropractic was not the only thing that I wanted to get into, so I've gone into functional medicine and functional neurology, and I study somewhere in the neighborhood of 80 hours a month to learn and understand what's going on with the body besides musculoskeletal. So I tried to explain this to this patient, and she really didn't want to hear so much of that. And that's kind of sad because what happens is in today's day and age, the medical model is an acute-based care model, which means if you have, God forbid, a heart attack or a trauma, broken bone, something ruptures, or an infection, medicine does a great job. But when it comes time to a chronic condition and putting all the systems together, like your metabolism, your blood sugar levels, your oxygen levels, potentially if there's any gastrointestinal disturbances, any immune dysregulation, and then some funky stuff like heavy metal toxicities or environmental toxins like parasites or Crohn's, Lyme infection or Epstein-Barr virus, or even things like electromagnetic frequencies. So these are things that take someone to look outside the box and to determine what's going on. So I just wanted to make this little video to explain to you that if you're suffering with a chronic condition, consider trying to put all the pieces together and not just taking this pill and that pill, and hopefully you can get help in the right direction. If you're looking for a little bit of help, give me at my office a call. It's 561-883-0090, and I'd love to be able to discuss your thyroid case. Thank you so much.